Hello! So this week's video is going to be on a subject I've been spending a lot of time, I suppose, listening to podcasts and, I don't know, personally experimenting on, which is pretty much my life legacy, which is improving longevity in our health and when that comes to aging. I think most of my teachers would agree that we age too quick, both from our inner organs and our largest one, which is our skin. And this is usually due to multiple reasons. I heard one of the podcasts I posted recently was on a holistic doctor, and he was saying, I'm a holistic doctor because I treat a whole list of problems. And I resonated with that a lot because as a holistic skin therapist, when you start actually treating the root cause of aging, a lot of the list of problems disappear. And that's really encouraging and it's really inspiring because there is so much practical day-to-day rituals, habits, lifestyle choices we could actually make to dictate how quick or how slow we age. So today we're going to talk a little bit about collagen, we're going to talk a little bit about peptides and why we might topically apply them and why we might ingest them to improve longevity in our health. So if you bring back to the basic principle of our skin ages from free radical damage. So we say our body corrodes, literally. Free radicals simply attack the atoms of our cell, which allow this basically war, which then cascades and breaks down every other cell in its path. So if we have enough antioxidants, they undo that problem. So think of a simple skin cell. A skin cell, when we're born, it's born perfect. So that cell stores about 90-ish% of storage forms of vitamin A esters and a little bit of vitamin C, a little bit of vitamin E, and that gives the fuel for the cell as it divides, because our skin's constantly dividing, to divide healthily. So when I say to patients, look, we're born with about 90% vitamin A. By the time we're 15 years of age, a lot of that's already depleted from environmental factors. And depending where you live in the world and your environment, unless that's put back in, now we're dividing imperfect. So we want a lot of vitamin A to keep the cells normal. And we know when cells divide normally, they don't divide with defects. So the good news is there is a simple process to replenishing that nutrition supply and then maintaining it. It has to be personalized because we all have different environments that deplete and a different history. However, the next thing to consider, if we need that antioxidants to mop up all the free radical damage and normalize the cell function, why do we talk so much about peptides? So peptides, when it comes to food, are proteins, and we know proteins are the building block for muscle. In Chinese medicine, they say if you're going to eat an animal, you should eat the part of the animal that you're trying to repair in your own health. So a lot of us eat the muscle of an animal, being the meat, and unfortunately that hasn't got as much nutrition yield for the skin as the collagen, being the skin. So one collagen I use a lot in the clinic is this hydrolyzed collagen. So it's pre-digested, which means once it gets into the intestine, the body doesn't really have to break it down. It absorbs straight into the bloodstream. Now this is building blocks for skin. So this is type 1, 2, and 3 collagen. That's why it's so effective. Bovine is from a cow. There's also marine. I do use both, obviously for different personal preferences. But they do show in case studies that bovine is more close to the human anatomy of collagen. So thus why it might be more of an all-rounder and a little bit more helpful for most of us. However, I do believe in variety, so switching up marine's good. There's another blend of collagen that's coming soon, which is really exciting for hormone balance as well. It's a different blend, so I'll teach you about that down the track. But collagen works to regenerate the areas in our body that need that collagen. So our skin is made of collagen, Our organs are made of collagen, and our joints and ligaments. So that's why it has so much health benefits. And when it's so easy to break down, it means that often our blood's going to utilize it. So they've showed ink stains in science with skin, how much by ingesting a percentage of collagen per day can really improve the phytoblast function in our skin. So phytoblast cells live in the base of our skin, and we've spoken about them in past podcasts and past videos, that they actually stimulate the collagen, the elastin, and the natural water jellies, which we call kind of like fillers, that give the skin that spongy hydration glow. I don't put moisturizer on to look spongy and glowy. I actually stimulate the phytoblast cells and use tons of antioxidants to keep them thriving. So when it comes to phytoblast cells, they're very lazy. They live in the base layer of the skin, in the living layer, the dermis, and they need a ton of antioxidants to function. They also sometimes need stress. so they need a controlled stress to function, and that's why we talk a lot holistically about intermittent fasting for our inner health. We talk about hot and cold therapy. We talk about styles of exercise that all stimulate human growth factors and phytoblast cells. So there's lots of clever ways and mechanisms you can do to improve it holistically. Topically, we use often two things. One, topical peptides, which we'll talk about now, and two, a medical procedure that I do in the clinic. So it's a specialized style of medical needling, which is a controlled stress on the skin that stimulates the human growth factor. There's also more gentle treatments like cool peels, which also have this effect. So let's go into first topical peptides, which is something you probably all, if you're an advanced student of mine, use every day. So it's really cool to learn of it. I've got 3 here. So we've got frown serum, which uses peptides, but also uses ingredients that mimic Botox to reduce nerve talking to muscle, so it softens expression lines. We've got elixir that stimulates the collagen and elastin phytoblast cells directly and has an amazing ability to help that building blocks for that factory to function. And we've got night serum, which is a really powerful antioxidant, anti-inflammatory, which also combines neuropeptides, which reduce nerve and muscle function. This one more works on the stress, so the mind and the nerves. We've learnt that our skin's very rich in nerves, and I'm seeing this a ton, especially in the last 18 months, where clients are getting inflammatory skin conditions due to the mind being a little bit uncomfortable with pressure and urgency, or maybe the uncertainty in the world, and that's causing a direct flare up in their skin. So this has been a real godsend to help with that. So why we would use them is simply because when you're using antioxidants, these work kind of like protein or messengers. So they help to carry the vitamin deeper into the cell. They're also liquid fuel for those phytoblast cells to function. These are 2 really important things when you're trying to get better. Skincare is a little bit like exercise. If you do the exact same thing all the time, don't expect change. You need to rotate, you need to change, you need to focus on your target concern and make your daily ritual, your daily skincare and your treatment strategy designed to treat this. So all serums applied into your skincare is going to cocktail. Sometimes these work better applied to the skin after rolling. Give it a little bit of time before you apply your antioxidants on top. So peptides in a nutshell are really, really critical to getting younger because they stimulate that factory that makes collagen and elastin. And we want that. We want to age slowly, not speedily. So in a nutshell, when we're introducing internal collagens, we're introducing peptides into our skincare, provided we have a lot of antioxidants, you're going to see the skincare become more powerful, which means when you're applying it, it's going to do more for you. It's going to enter into cell walls more efficiently, which means it's going to create physical change in the skin. When we're not entering the skincare into cell walls, you might see plateauing because the skin cells isn't actually utilizing the vitamin itself. It's just sitting on top and feeling good. So we're always looking at ways to manipulate the skin to improve cell function. So we're going to leave the video there, short and sweet today, but I just want you to think about that general concept of collagen and elastin needs fuel to function. So consider that. What you put internally impacts this. Then secondly, what you apply in your skincare, if you've been using antioxidants for a while, you might want to consider starting to look at peptides and making sure the peptides are used in a method of the recipe that will get results, because a lot of people use them incorrectly. All right, so any questions, please leave below. Otherwise, have a fabulous day and I will talk to you soon. Bye for now.